Rotavirus. Rotavirus is a common virus spread among children in early learning care centers. The signs and symptoms are fever, nausea and vomiting, abdominal cramping, watery diarrhea, and this can sometimes lead to dehydration, coughing and a runny nose, and these signs and symptoms usually appear within 24 to 72 hours after they are infected. Transmission happens during the winter and spring, and it's usually transmitted through stool, kids touching something contaminated and then putting their fingers in their mouth or touching their face. Caregivers can spread the virus if they do not wash their hands enough also.
For the Ottawa Public Health Regulations, schools defined as a sudden or unusual increase in absenteeism due to similar symptoms in students, staff in a class or school in the same day. 10% absenteeism due to similar symptoms in schools in the same day. Cause, symptoms, bacteria, virus, or parasite, vomiting, diarrhea, abdominal pain, headache, fever. Transmission depends on the cause, usually fecal, oral, root, or through food and water contaminated with bacteria, virus, or parasite. Exclusion. Exclude until 24 hours after diarrhea is resolved. If diarrhea recurs within 48 hours, recommend to parent, guardian, the child to be assessed by a physician to see if a stool culture is needed. Exclude if vomiting 2 or more times in the previous 24 hours, unless the vomiting is determined to be caused by a non-communicable condition and the child is not in danger of dehydration. Prevention at the Early Learning Center, hand washing before and after meals, hand washing after going to the bathroom, immunization are up to date. Clean the toys well because the virus can stick to the surface of them.
What to do at the Early Learning Center? Children with symptoms of rotavirus should remain away from the child care center for at least 24 hours after the symptoms have resolved. If the child care center is involved in the outbreak, the time is increased to 48 hours until the symptoms have resolved. People ill with the symptoms of rotavirus should be separated from others. Regular cleaning schedules with a rotavirus outbreak occurs should be increased and amplified, as well as paper disposed of fecal waste. Rotavirus is resistant to most common use of disinfectant. Therefore, you should use a bleach-based cleaning or chlorine, but it should also be non-harmful to children. If your child becomes, that's you, sorry.
What the parents should do if their child get infected? If your child becomes severely dehydrated, they need to go to the hospital to get fluids. Call your doctor for advice on how to treat it at home. Certain drinks and food may help treat them. Certain drinks may help replace body fluids.
And that's how to prevent the rotavirus.